So, hey, I bet you remember it.
Yeah.
So creed maneuver. Okay, that's all I'm thinking there. How old are they to be, do they need to be diagnosed with enuresis or encopresis? All right, 4 to 5, just depending on which one we're talking about. I like that. Why might children be unsuccessful or have enuresis? All right, could be early bladder training, that they're not picking up on the cues yet. What else? Good. So developmental delay, maybe cognitively. Okay, what else? Could be behavior, but why? Which one's the most popular enuresis? So bedwetting when?
They want to do something, but they don't want to stop doing it.
Well, when does bedwetting most oftenly occur? Well, I mean, obviously at night, but enuresis symptoms are most prominent at night. Yes, your kids may be incontinent during the day, or whatnot, but the most common place that you're gonna catch it's the bedwetting at night. What else can be associated with enuresis? Like mental health wise, we haven't talked about it, and you'll do it some more next semester. But think about your kids, yes, result in what thing at nighttime that may also make them better. Night terrors, nightmares, things like that. A lot of times you'll see those associate together if there's a lot of trauma or insecurity, which we could go all the way back to Erickson's stages of development. I will not torture you with that. But thinking about if they are lower on that, they don't have that autonomy, then they may have nightmares that are associated with enuresis. So you may see that. What type of reward systems are you going to use for those kids? Positive reinforcement. So not making it a shameful experience, not getting on to them. They're just going to be a part of the process, part of the cleanup, and get them some of those. We start medicines around 7. What was our favorite medicine to start? Which is your ADH. Catheter should never be the go-to or ideal for strict eyes and nose. True or false?
True.
That is true. What catheter, or why might somebody get a catheter? Give me a good reason for it. Urinary retention, surgery, I like. Huh? Yep. If they have a perineal skin issue that we need to preserve skin integrity. Would be if they're on medicines that would affect their renal functions, we would have that strict one. What size for a standard catheter are you gonna grab? Just for a routine catheter you gonna grab? Standard sizes you gonna think about for CBI? 22 plus, yep, garden hose plus. What type of catheter should be considered if a patient needs it long term?
Super.
How often do you change catheters? Both, depending, either style, indwelling, or suprapubic. 30 days. And then some insurances will allow you for 28, but just 30 is your nice round number. 30 days, 1 month, we're gonna change them. Who can change them out? RNs can change them, LPNs can change them, nurses, anybody who says LPN, because it's LPN semesters, can change those. What you gonna do if a suprapubic catheter becomes suddenly dislodged?
Call the urologist or
Even better,
put something in it.
put something in there.
You gotta put something in it.
So I would typically put another Foley and inflate the balloon, just you need something to seal off and hold that place. So they typically tell you to just go ahead and grab another Foley, even if it's not the right one, just stick something in there to help keep it open. They also have those obturators that we're learning about with tray 2 that can also be used. You just need something to plug the hole because believe it or not, if they're fresh, suprapubic catheters, they can close up surprisingly timely considering how large the hole is, but they will. So the best practice is to grab another Foley or at minimum an obturator, just something needs to go in there to keep it And yes, call urology and let them come and place it if there's difficulty getting it back in. Let's see, what two things are most essential in preventing bowel obstructions? Fluid and fiber, and we tired of those two. What are some risks that could happen if the small bowel obstruction does not resolve timely? Okay, that's our worst case, and then what were some of the other four that were on the screen? That one where it accordioned in, or volvular strangulation, all of those.
Intussusception happen more with children.
It does.
Yeah.
Cause it's smaller and it can slip back into itself. But it can happen with other patients as well, but usually pediatrics are most common for those. What must be done before NGT can be utilized? Yes. We talked about how long to be left on a bedpan. What are some signs of UTIs? Burning, dysuria, pain, odor, like it has an odor to it. Confusion in your old people, that's usually your first sign. Just a brief understanding of those procedures that we had, the surgeries, the lithotripsy, TURP, the digital rectal exam, all of those, because you're not gonna perform those. But if you read them in the stem of a question, what has the patient gone through so that I can pick the right nursing action? And that's about all. I mean, they're really straightforward. There's not many curveballs that I can think of. So just know what patients might get them, what your patient's gonna complain of if they have that problem, and what you're gonna do about it. What might be some things the physician or the nurse will delegate to them. And then always, how are you gonna teach them not to have that problem? So is the roll sheet, did everybody have a chance to sign your roll sheet? Okay, and then if you are not a math